How do I turn my screen on? Okay, there you go.
All right. Okay. How are you doing, Kyle? You got everybody?
Yeah, everyone's been admitted. There's still people trickling in, but I'll continue to admit them throughout.
Okay.
But right now, it's empty. Everyone's in.
Okay, thank you. If more people come, they can trickle in, as you say. Well, thanks, everybody, and welcome to our board meeting today. I'll call the meeting to order. Is any disclosure, any peculiar interest? Does anybody got any conflict, board members? Seeing none. First off, today we have an actual delegation, and it's a 5-minute delegation subject to mandatory masking of children in schools. And Mark, I hope I get your last name right here. Is it Parloffs?
Oh, hold on.
Go ahead, Mark.
Parolovis. Sorry, I thought it was.
Sorry. I should have figured that out. Okay.
No, that's okay.
You're on, Mark, and we got a 5-minute. We'll give you a minute heads up for you to do your presentation. Okay.
I timed it. It's exactly 5, I think.
Okay, good. Thank you.
Okay. First, thank you to the Board of Health for allowing me the time to address you. I do appreciate it. I respect the work that is done to ensure public health, and I appreciate you guys. For context, I'm going to speak briefly about my personal background and experience. I have a long history of working in helping professions. I spent 15 years in children's mental health and working in schools. Before that, I had an intimate knowledge of the foster care system in Guelph. I was also an active union steward through my years in education and mental health, so I have a deep understanding of policy development. Also, with a deep understanding of child protection and best practices with regards to policy making for at-risk populations of youth. That's why I'm speaking out. What's going on in our city and our province is abhorrent and unacceptable. It violates our basic rights. The recommended abuse by public health of children, or for children who are healthy yet deemed high risk contacts, is frightening, as it's been brought to light and ignored by leadership at the provincial level. The Milgram experiment, referenced in my letter, is a good example of what we're currently living through. In Milgram, they measured the public's compliance with authority. What it found was that if a person in authority told a teacher to administer an electric shock to a learner, the teacher would be upset, would beg the person in authority to stop the trial, but would comply. They would administer the electric shocks until the subject's death. And the subject didn't exist, but that's beside the point. This is exactly what's happening right now with mandatory masking across the health unit. You have created a situation where basic rights don't matter, and authority figures are telling parents through public orders to harm their children, and they're complying. You are the only ones who can stop this horrific abuse. The damage being done by mask mandates is very concerning. We've had a child suspended in Guelph for accessing his exemption at school. He was distanced and got punished for removing his mask outside. This is despite a large body of evidence that mandatory masking does not reduce the spread of respiratory virus. I outlined my data in my letter, so I won't rehash it here. We've had public health recommend isolating children by themselves for 14 days if they're deemed high-risk contacts. If I were to do that to a child outside of public health's direction, I would very likely have my children removed from my care. Yet the leadership has said nothing. This is shocking and abhorrent. It is now your responsibility to stand up for our children. Early in the pandemic, there was caution by many doctors and public health that wearing masks for healthy people is not beneficial because people fiddle with them and touch their face a lot more when wearing masks. What studies or data have been released that nullify that concern? What are the potential developmental impacts, physical impacts of prolonged mask wearing? Are instances of bacterial pneumonia or hypoxia considered? Instances of impetigo? What are the developmental impacts to children under 7 of being forced to wear a mask for extended periods, multiple days in a row? Was the still face experiment taken into consideration, also referenced in my letter? Are parents informed of these potential risks? If not, why not, as informed consent is necessary for any medical intervention? Where is the handout that outlines the risk factors for prolonged masking of children or prolonged masking of infants, or risk factors for prolonged masking of adult humans? Now that you're aware of the damage being inflicted to children in our health unit, what compelling evidence do you have that masking works? How are you measuring the efficacy of masks in the school setting? Specifically, what studies and what data are being used to drive the decision to continue to force children to wear masks all day, inside and out? Further, what criteria need to be achieved to repeal this damaging and ineffective intervention? Infection curves in places with mandatory masking are the same as curves in places without mandatory masking. How and why is this being ignored? Similar to lockdown metrics, it seems that the data used to continue mandatory masking of children is not robust and is not public. Without a clear way to measure success or failure, it's impossible to gauge our progress regarding both masks and lockdowns. Why did this health unit, this was asked. When children become victims of bad policy, it's time to act. The child who was suspended in Guelph because he removed his mask was complying with the law by removing his mask. Because the people in authority, you guys, have a Section 22 mandate in place, the child's right to decide if he needed to breathe freely was removed. He was punished for having the gall to do it anyway, suspended from education, for the crime of removing his mask. When the exemption is clearly written into the law. Was that the intent of the mask mandate? I can't imagine that being so. When children become the victims of bad policy, it's time to act. We have far too many victims in this pandemic already. We don't need to create more by continuing bad policy. One more story and I'm done. When a peer in a class gets sick and a healthy child is deemed a high-risk contact, they still get a letter sent home telling parents the child must isolate for 14 days even with a negative COVID test. The guidelines around this self-isolation are not appropriate and would constitute abuse or neglect in another context. Parents have followed this advice because they were told to by an expert. The threads on Twitter are awful. If you don't act, and act soon, who will? Who can? Thank you for your time. I do appreciate it.
Thanks, Mark, and thanks for your input. Any questions for Mark? Okay, thank you, Mark.
Thank you.
Okay. Next up is the approval of minutes of February 3rd, 2021 Board of Health meeting. I have motion to approve the minutes of the February 3rd, 2021 as presented. June and Ralph, all in favor? Opposed, if any? None. Thank you.
Opposed.
Sorry, it's just committee members. All right. Okay. Next up is the MOH updates. If Dr. Mercer wanted to do an update for us.
Sure. Thank you very much, and thank you to our Mark for providing your comments. I appreciate your honesty. So I just wanted to, before I go into just do a little update about our vaccination, I just want to talk to clarify one of the things that's on our website, and that is people often ask me questions of why are we in red when this number is green, that number is orange, that number is yellow. And I've been getting some letters and some concerns that we should be, in fact, one person said we should be green and yet we're in red, we should be yellow, we're red. What does that mean? And so I just wanted to just really provide a very high level to the board and members of the board that not all of the information on our website would be equal. So when we post things on our website, what the province uses in terms of determining where we should be as a classification and what's on our website, they're not all equally biased in terms of what they take into consideration. So the most important statistics that are on our website are the confirmed cases, which is a 7-day moving average per 100,000 for our area, as well as the test positivity. Those are the two most important numbers. There are other numbers on our website which look at health system occupancy or the public health response, and those are just kind of nice to have numbers, but they don't actually aren't weighed nearly as heavily as the confirmed cases and the test positivity. We did very briefly after a few weeks ago now, I think it was February 19th or 20th, we actually, from a confirmed case, actually touched a low point which put us into yellow. That was very brief. I believe it lasted 2 days, and we have been steadily climbing since then. And since Monday of this week, our status locally has been red. Our status for test positivity at 1.9% has also been slightly increasing, again, puts us in orange. Do I actually control where and what status we're in locally? I think that's another question that I often get, and the answer is no. Sometimes I'm asked for input, and usually it's specific questions as to what is happening locally. Can you explain this? And if we have a very large outbreak that's driving our numbers, I will mention that, and I will advocate very hard that that is not taken into account when they look at our numbers. But the overall response and the overall determination is not made by myself, but is made by the province and approved by Cabinet. I do everything in my power where I think the numbers do not adequately reflect what is going on in the community to make sure I say that. But I think it's really important to recognize, and that the fact that we are trending this week and we have been red for 3 days this week already, to me bodes poorly that we will move out of red for next week, and that we will likely remain red based on our current numbers, and that we have been red now for a number of days. So I think it was just important, and I wanted to share those thoughts. And now as I move to my next topic, I would like to share my screen. And so I'm hoping I do that. So let's just figure out how to do that. Kyle, can I share my screen, or is that not possible?
Yeah, sorry, that's my fault. You're now co-host, so you should be able to share your screen on the bottom where it says share screen.
Okay, thank you. I'll just see if I can show this, and then I will. Can you see that now? I just want to make sure that people can. You can see that. Okay, that's great. So I just want to talk about this. So locally, we've been rolling out our vaccines, and we've been having tremendous success. And I wanted to sort of go through who's been vaccinated, who hasn't, where we're making progress, where we're still trying to make some increased response. So locally, as everybody knows, we originally, when we were doing our long-term care and retirement homes in particular, the residents and the staff, we were doing that. We know where the people were. We knew where they lived. We knew where they worked. So that was a program that was actually fairly easy to administer, because we didn't need any kind of booking or registration system, because we could go right into their homes, because the residents were not mobile. In fact, we had to go into their homes to immunize them. But as the province moved beyond that, and as we completed our long-term care and retirement home residents in particular, and have made substantial progress on staff and essential caregivers, it became more and more important that we had a way of registering people and then booking them into appointments in our clinics. So we prepared last fall, and we installed a new booking program, which we actually trialed and practiced with during the flu season, and then have deployed that for the purpose of the COVID-19 immunizations. What we also did was we built a pre-registration system, which has fairly recently been deployed as a way of gathering the information of those who are interested in receiving a shot. It's really important because not everybody wants a vaccination, but a way of gathering them, a way of sorting them, because the province has provided us with some very specific categories that people must fall into. And then if they meet certain criteria, we invite them to book appointments into the clinics, and they can do that on their own by booking online. So that is the process, and I just want to go through each of these categories and tell you how it's been going. So if we look at the residents, staff, and essential caregivers of our long-term care and retirement homes, they are nearing completion. So all of the residents who have wanted a dose have received one. I know if you looked on our website, you would see that our second doses aren't quite as high as our first doses, and there's a very valid reason for this. We've had some people, some of our residents passed away before they got the second dose, so there's a discrepancy with that. And we've also had some people go into the homes who've managed a first dose and yet haven't had an opportunity to get a second dose. So the residents in long-term care retirement homes is not a static number, but it is constantly in flux. So our staff are also very much a high priority group. We had, I would say initially when we rolled it out, a fair number of staff decline. And that was not just unique to Wellington Dufferin Guelph. That was fairly common across the province, with the numbers being anywhere from 30 to 50% of staff within a home would choose to have the vaccine, and many would not. So we continue to work to ensure that our staff are offered. The way our pre-registration system works, if any staff of a long-term care home is identified and they tick whatever home they are in, they are always 100% of the time, every day, offered a booking appointment. So staff of these settings are always prioritized to receive a vaccine. For essential caregivers, they are also were identified through the homes. We have a number of processes where we've been trying to immunize our essential caregivers. So we do have a pre-registration process as well. We did find that there was a lot of people who booked into this category who didn't meet the definition of essential caregiver. So this list, our online registration was actually compared to a list that we had from the homes, because the homes give us a list directly. So we were able to compare. And then we were able to offer those people who are vetted and are on our list, we offer them appointments to the online system. We've also been calling them, and I know we've called more than 1,000 essential caregivers to offer them appointments. So this group is essentially complete. The alternate level of care patients, this is in progress. It's quite difficult to do this because the vaccines can only be moved once. And we have vaccine that comes in vials of 10 or comes in vials of 6. So what we've been doing is, where a hospital manages to accumulate, say, 6 patients or 10 patients, then what we do is we go and immunize all of those people at one time. Sometimes we're able to substitute if there's a staff that's needing a second dose, we try and combine them. But essentially, this is something that takes a bit of time, and it can't be done on a dose-by-dose basis because the vaccine can't be moved. Healthcare workers in our community are divided into a number of categories: highest priority, very high, medium. So those are the categories that we have, and these are provincially determined. So I didn't make this up. So our highest priority healthcare workers are our hospital and acute care staff, medical first responders, all of our people who work on COVID floors. Those would be in the highest category. So those are well in progress, and I'll just give you some numbers. So those were done in a few different ways. So early on, we actually were offering and trying to get hospitals to give us numbers of their staff and invite them to our appointments. So in that case, Headwaters Hospital actually is substantially complete. Very early on, they made sure they released all their staff to get done. The Guelph General Hospital, our largest hospital, is also, it's not quite complete, but it is substantially complete. They were releasing hundreds of staff to attend our clinics, so that worked well. It didn't work as well in North Wellington. We found that when we offered the staff at the hospital's appointments, they declined. We had a clinic set for 100 people. We only had 9 show up once. We've done that several times now and had them decline. We have 500 spots available this Friday and Saturday, and we're really hoping, and they've all been offered spots, those who are pre-registered, so we're really hoping to make inroads in the Groves and North Wellington healthcare hospitals, but they have not been as easy to either pre-register or to book appointments. So they are definitely, and we've been sending them multiple emails to their leadership, trying to have and understand why their patients aren't, or their staff are not pre-registering and are certainly slower to access the available appointments than our other hospitals. But we're working on that, and I'm hoping after this weekend that we'll make substantial improvement in their immunization rates. When it comes to our community healthcare workers, that you can see them on there, our physicians, our specialists, dentists, pharmacists, people who work in our communities, those have been registered, and anybody in all of our areas, so whether they're in County Dufferin, Wellington, or City of Guelph, anybody who is pre-registered and falls in a very high priority healthcare worker category, they have all been offered appointments and they've been asked to book. So anybody, and every day that we check our system, and it's done daily, Monday to Friday, every morning we meet and we look to see who is registered. And every day, the highest priority healthcare workers and the very high priority healthcare workers are released. And those people are offered and able to book appointments into our clinics, and they are doing so in large numbers. When it comes to adults over the age of 80 who live in our area, I have to say I was very worried that this wasn't going to go well based on this age group, because I was concerned that we wouldn't be able to find them all and get them pre-registered. So we've had a number of approaches with the over 80. So first of all, we know our estimated number is about 12,000 people in our area who would meet this category. Anybody who was in a long-term care retirement home would have received their immunization first. So estimated numbers, that's a little bit harder to understand, but it's a little close to around 2,000, maybe a little bit more people qualified in that category, which left us approximately 9,500 to 10,000 people who are living in our community who are over the age of 80. And we are finding that substantially that these people are registering, and they're continuing to register. And so it is great news. And so we are pleased. But if you, even this morning when we released the numbers, we had 1,600 additional adults 80 years of age and over who have registered. And we, of course, released them, invited them to book appointments. And I was just in our Chancellor's Way office today. It's where I'm sitting now. And I was downstairs, and you could see dozens of seniors over the age of 80 accessing the building in order to get their shots. We continue to offer this. They will always be eligible. So once you are eligible, you are always eligible, and we'll continue to work through this, this priority group. High priority healthcare workers. So those on this, again, this is a definition by the province. We have started to release these healthcare workers to book appointments in the system. Again, we have lots. We are not through this category, not the way we are our highest priority, very high priority. We are substantially through those. I would estimate that we would be far more than 50%, and especially for the highest priority healthcare workers, probably closer to 65 to 75% complete. But when it comes to our high priority healthcare workers, we're less than 50%, but numbers are being released every day. And I am very optimistic we will get through these in the next week to week and a half. Indigenous adults who live in WDG, we know that there's a large number. We certainly release them to book appointments, and they are accessing it every day in small numbers. And we're also looking at ways, particularly for this group, we know that there's some who don't have a government-issued ID or don't have health card numbers. And we are going to be working with our community health center and as well as groups that specifically have relationships with our Indigenous community in order to ensure that they have access to bookings. And so we think this is very important. Adults, recipients of chronic home care, this is a challenging group. Remembering the vaccine can't be moved person to person. So under normal circumstances, we'd love to, and I know our paramedics would be available to take the vaccine home to home, but we can't do that with this vaccine. We might in a future state, but currently that's not the status that we have. So we are making arrangements in smaller groups to ensure that these people can access our clinics, and making sure that we'll have to have specialized parts of our clinics, when I say parts, times where we can ensure that these people can access, as some of them will require transportation, specific types of transportation in order to have them access vaccination. It's unfortunate that we have to do that, and hopefully that will not be for long. So I'm now going to hopefully stop sharing. Did that work?
Yep, it worked.
Okay, that's great. Thank you. And just want to remind everyone that even though COVID really consumes the vast majority of what we do right now, the vaccination program is really starting to ramp up. We're working with our community partners, and today at 5:30, I will have to step off our board meeting because I'm presenting to the task force, the provincial task force on the COVID vaccination, and on behalf of the Board of Health to talk to them about the WDG program and how we've managed to get ahead, in particular when it comes to over 80s, as well as our community partnerships. And in this particular case, they're most interested in a partnership that we're going to have with Linamar and rolling out our vaccine program in collaboration with a private sector entity. So they're asking me to speak to them about that. So, and there you are, Mr. Chair. Hopefully that's
Okay. Questions for Dr. Mercer? Guy.
Thanks for that update, Dr. Mercer. And certainly I'm going to speak on a first-hand basis of the 80 plus and how well that is working in from my experience of registering and getting everything's going through. So that's impressive, because we're well aware the older you are, the less digitally tech you are, but I'm hearing positive things from different sources. I just have a question. It's been raised about the racialized groups are more prone, and is there any chance that we're looking at prioritizing that group? I'll let you respond.
Yes, and so if you look provincially, they're looking at specific areas where they have high concentrations of people who identify as Black, Indigenous, or persons of color. And those areas, as a province, they're considering whether they will have earlier access or additional access to vaccines. If you look at Wellington, Dufferin, Guelph, the communities, there's only one very small part of our area that would qualify. It's not in Dufferin County. There's a very small area that is to the west of Guelph, sort of the Silver Creek area, and that might qualify, but essentially our area does not have one of these specific criteria. When I worked with our task force locally on prioritizing healthcare workers, we discussed this at depth, and one of the decisions of that task force as we looked at prioritizing, and this was only healthcare workers, it was not a community. As we looked at prioritizing that, being a member of the BIPOC community was identified. And so if we couldn't immunize our community healthcare workers very quickly, and we are doing so, which is great news, that would be one of the factors we should take into consideration when offering immunization to our community healthcare workers. So again, not speaking broadly about community members.
Okay. Thanks, Dr. Mercer. Any other questions? I just want to say, Dr. Mercer, oh, sorry, Al, go ahead.
Mr. Chair, I was talking on mute there. Since the announcement has been out about some of the mobile ones in the north part of the county, I'm already getting calls, and I understand and I'm fully support what we're doing there, but we do need to get to the people of Erin a plan of when and what may happen over here. Right now, it looks like they're being excluded, and I know you're not, but I really would appreciate something that came out and said, here's what we're planning for the town of Erin.
Well, of course, the town of Erin has complete access to any of our clinics, and in fact, many people from Guelph are having to drive to Fergus, for example, to access vaccination clinics. But we do and recognize that access is important across our area, and we are looking at mobile clinics across our area with our big centers, the ones that are really meant especially for mobility issues. Fergus is an excellent spot for that, not much our Chancellor's Way location, but we continue to take that into account. And Rita, I didn't know if you wanted to comment any specifically about the town of Erin. And
so at this point in time, we have looked at a clinic in the town of Erin, because right now we're looking particularly where our concentrated areas are related to individuals that are receiving chronic home care. And so based on the geomapping, Erin isn't one of those areas, but it will be an area. It will be an area that we'll be considering in the future based on the increased number of people that we're able to include in our vaccination program.
Thanks, Rita. Alan, did you have a follow-up there? Or?
Oh, that's fine, George. Thank you.
Okay, thank you. And Ralph, I see your hand up. Go ahead, Ralph.
I want to compliment you and your staff about the way the registration process has been working. My experience with it has been very good with a number of people. There is a little issue with the phones. They seem to be overloaded, and wondering if there's something can be done to expand that. Before I answer that, I just have one question about the whole appointment process. It's a little bit confusing to people when they hear that the Ontario government is going to set up an appointment process that begins on the 15th of March, and then they find that there's also local appointments that, like we have, which are working very well. How is this going to? What's going to happen on the 15th? Are we going to fold our appointment process, or are we going to carry on?
Yeah. That is a great question,
great
Ralph.
question,
and so I'm sorry that I forgot to mention that. So you are correct. The province does have a system that's coming in on the 15th. What they have asked, though, is they have asked for health units who currently have a registration and booking process as well as a phone process on their own. They've asked if we want to continue it in order to ensure that the province's capacity is not overwhelmed. So we have all of those things in place already, our booking system. So I've made it clear to the province that we will not be moving to the provincial system. Remembering, of course, that all of our data does get uploaded into COVAX. So we are not operating as an island. We are running our registration and booking system to give people vaccinations, but all of our vaccinations are linked to the provincial system. It's just another way of getting there. And so every health unit, and I would think that we're not alone. I think there are quite a few. Peel, for example, I think Hamilton, I think there's a number of large health units that are also not going to be using the provincial system because they already have their own system up and running. So that was a great question. And I can't remember what was your second question? Sorry.
Yeah.
I can't remember what the second question was.
I can't either.
Sorry about that.
It was about the phone lines, Dr. Mercer.
Oh, the phone lines. Yes. And I am looking, Kyle, are you on the line at all? I'm wondering if you would like to speak about the new phone system that we're putting, just so everybody knows. We had on the first day that we had a lot of people ready. I think we had more than 20 people on our call center ready to go. We had 15,000 calls in at one time, and that totally dropped our phone system. So we have invested, and believe me, we had already enhanced our phone system before this happened, but now we have invested specifically in another type of phone system, Amazon technology, and I will probably get it wrong. And if Kyle's not on, maybe Emerson could say just 2 words what it is.
I'm on, Dr. Mercer.
Oh, sorry, there you are, Kyle. Yeah, there, sorry.
So yeah, as Dr. Mercer said, during sort of when some of the registration were going out and we were getting into the online booking, we were getting a lot of phone calls. So we had about 15,000 at the same time, which our system can't handle. That's quite substantial for us. We usually don't get nearly that much phone traffic. So Emerson and the IT team have done a great job and actually lit up the Amazon cloud-based call system or call center. We'll actually be going live with that tomorrow. So we'll have a separate number. So 1-780, we try to get a catchy number that people can phone for all things registration and all things online booking to take the load, get that number of calls off of the WDG phone system, and we can have our day-to-day operations and calls that we do still get. And all things registration and booking are going to the Amazon cloud, which we can ramp up or ramp down depending on traffic, and it can handle that load.
And I just want to comment that if we were to experience 15,000 calls again, I think I just don't want to have people's expectations that we're going to be able to manage 15,000 calls, because we still won't be able to, but we are absolutely ramping up the number of calls we can. We are hoping, and one of the advantages with using registration and then self-booking is that you can actually move thousands of people into your online clinics without without going through a manual process. And if you think about it, we have about 250,000 people that we have to immunize twice, 500,000 people. And so we've already done almost 18,000 of them. But still, if you think about that, that's a massive number of people that you need to move into the system. So the only way to seamlessly do it and to have literally thousands of people all accessing and doing what they want is to do this electronically. And so we have a system set up for those who can't. We absolutely want to make sure that we continue to do that. But everybody who accesses it, the self-serve portal, makes room for those who need to use the phone booking system.
Great. Thanks,
Mr. Chairman?
Yes.
Yeah, I'm sorry, but I can't get my video back on, so I can't wave at you. But I have another question. And
sure, go ahead, Al.
I've been asked this by a number of people. We now have 3 vaccines, and the perception of some people is that one may be not as effective as the other 2. And so the question is that people are asking is, will I be able to determine which vaccine I get?
That's a great question, Ralph. And so, yeah.
Sorry, go ahead, Doctor.
Well, that's a great question. So first of all, when you come to book an appointment in our clinics, the only 2 vaccines we've ever had are Pfizer and Moderna. We've had very little Moderna. So all of our clinics right now are being run with the Pfizer vaccine. The vaccine that you talked about that's been newly approved is the AstraZeneca vaccine, of which I believe it might be arriving tomorrow. I don't know who's getting it. The original thought was that this was going to go run through our pharmacies, and I'm keeping my eye on Matthew in case he shakes his head yes or no, because I know that he was at a meeting at 4 o'clock that I wasn't on because I'm here trying to find the answer to that. So is it top secret, Matthew, or could you say something?
I don't think it's top secret. I think you're right on.
Okay, so the intent is that it's targeted to a different population. One of the challenges with having, and we will have multiple vaccines, is you need to have a way of keeping track of that because people don't always know what they get or remember when they got it. So that's why it's so important that all the data goes into the COVAX provincial system. So when they come back because they forgot 6 months later and want their second dose, we'll know what they got and when they got it. But it is my understanding that those pharmacies who will be offering the AstraZeneca are not local initially. I believe that they're going to be in a few areas around the Greater Toronto area, and I'm in Windsor. And I think that those are the areas that they're going to be going to roll out the AstraZeneca. And it is targeted to those who are 64 years of age and under. And they'll see how it goes. And if that population is perhaps not as willing to take the AstraZeneca vaccine, because I do know and I'm aware that there have been some reports that it's not as efficacious. There is some truth in that, but I also think though that we need to put that in the broader context of what it does do. And if most of our flu vaccines, by the way, have much lower efficacy than the AstraZeneca vaccine. So in a bigger picture, in a situation where we have vaccine scarcity, we do not have enough vaccine to immunize people as quickly as we want, then this vaccine really does provide protection. And it works better in those, we think, that are younger, only because we don't have the data yet really for those over the age of 65. That is still coming in, and who knows, we might find in a month, or when Britain in particular looks and publishes their data, we'll have more substantial evidence as to what is the correct age group. But most countries have said 64 and under, and we'll see in Ontario if that's exactly who they roll it out to, but I'm pretty sure that's where they'll be starting.
Mm-hmm. Okay. Thank you. Alan. Go ahead, Alan.
Thanks, Mr. Chair. I noticed today in the news that Quebec is now using drugstores. Is there any indication that we may move to that?
Well, as I just mentioned, I believe the AstraZeneca is going to be rolled out through pharmacies. One of the challenges with the 2 drugs that we have, the Pfizer and the Moderna, is the storage requirements and the delivery requirements. There has been and I believe Health Canada maybe have issued it today, or at least Pfizer applied to it today, to have some different storage requirements for the Pfizer vaccine. But currently, the way that we manage and handle the Pfizer vaccine is not really conducive to being in a pharmacy or in a a primary care office. So as long as we have those limitations, then I would suggest that the AstraZeneca is a better one because it's a fridge stable vaccine to go into pharmacies. Once we get, maybe we'll have some changes in the storage requirements for Pfizer, perhaps with the new Johnson & Johnson when it eventually gets approved and it goes, again, it's another fridge stable vaccine. This will all make it more likely that we will have multiple different venues. And I think for many people, they might prefer to access, in particular, their primary care office. I think many people who go to their doctor for various other vaccines would like to access their physician or their pharmacy as they might for their flu shot.
And just in closing on this topic, Dr. Mercer, I just want to say that I give your crew a lot of credit, the staff. This is a very emotional thing, vaccines, and a lot of it throughout this period of this early stages of it, public health has been kind of under the gun a lot, and a lot of it's been lack of supply in some cases, changing supply dates, deliveries. I'm hopeful as we move forward into April and May that we get lots of vaccines so that we can actually implement, I believe, is a really good plan that's we've got put together, working with all the municipalities, all the other groups, and let's get it out there and let's get it done. And if we can get that going, I know that your team and working with the other groups have a good plan in place. And so I'm looking forward to seeing those other vaccines, or as you say, upgoing with ones we have. But thanks for all your work so far, and I do believe we're doing all right. And we've got hiccups. Let's get them fixed up, and we'll go from there. So I think I'll move on from here because we've got a bit of a tight schedule. So thanks for that, Dr. Mercer. And can I have do I have somebody move the report? June and Chris, all in favor for receiving the report? Thank you. We don't have any other presentations, no business arising. Consent agenda. The Board of Health receives the consent agenda, which has been given due consideration for information. Does anybody want to pull anything out of the consent agenda, or can I have a motion to Christine and June? All in favor? All right, thank you. Board of Health reports. And I believe this is Kyle's got this one.
Yes, this is the annual privacy report, and we actually have on the call here our privacy, and I cannot find you. I'm sorry.
I'm here.
Oh, you're there. Okay, that's great. Charles, sorry, there's Charles. He's our one of our privacy staff who wrote this report, and it just provides a snapshot of where we are as we look back over the year. And Kyle, did you want to say anything for this specific to this report?
It's our annual privacy report, very well done, so I do not want to take the credit for it. And I thought I'd throw it over to Charles to walk us through the report because he was the main driver and the main writer of this report. Charles?
Perfect. Thanks, Kyle. And thank you, Mr. Chair and the board, for the opportunity to talk to the report. So I'll keep this relatively brief. So the privacy program was not spared the impact of COVID-19 in 2020, just like many other aspects of the agency. You know, we've had some big changes, especially to the available resources and to the kind of work that we've been doing. I'll just speak to a couple of the sections. So we did, privacy breaches unfortunately continue. So we did have 9 privacy breaches in 2020. That was a little bit above what we would sort of expect in a normal year, where we might expect 7 or 8 breaches. But it's not necessarily unexpected given the new tasks and roles that staff have had to take on as part of the COVID-19 response. We did also, unfortunately, have a slightly larger than normal breach in 2020, where it involved quite a few clients, but we were able to detect it very quickly. It was reported to the privacy commissioner, in lines with the legislative requirements, and we were able to work with them quite collaboratively to resolve it. And if there was any silver lining of that, it did sort of allow us to learn, to learn from it and to make some adjustments to our processes, just to make sure that similar events wouldn't happen in the future. Moving on to access requests, we did have, we had 6 access requests in 2020. That's a little lower than normal, which isn't necessarily unexpected given COVID. However, some of them were quite large and did require quite a bit of staff time. And then move on to privacy impact assessments. I've talked about these in the past, and they're a great tool for being proactive about privacy and looking at programs before we launch them. It was a very small year for privacy impact assessments, largely due to the effects of COVID-19 and a lot of the programs at WDG sort of being on pause as we're focused so much on COVID. So there's only actually one PIA in 2020. And so lastly, I'll just pivot back to COVID-19. So, as with many of the programs at WDG, we were significantly impacted by COVID-19. Privacy staff have been assigned, other duties to assist with the COVID response, and so that certainly curtailed some of the time available to do privacy. And so we have suspended or at least some of the privacy things that we do, like the yearly privacy training for the various program areas, and that has increased the amount of time it takes us to get back to requesters with requests. But we remain in a strong privacy position, and we continue to support staff with their privacy needs. And we were actually in a very good position moving into COVID-19 on privacy, because we'd actually done a lot of the privacy work on some of the systems that we're using now to help staff work from home, and so we were able to pivot to that quite quickly without too much privacy work, which was quite fortunate. And yeah, so as I said, privacy was a challenging year, or 2020 was a challenging year for privacy, but we're still there for staff to help them with some of the complex privacy needs that have come up during 2020 and as part of the COVID response. We are expecting in the near future, looking a little bit beyond COVID, to some changes in privacy law at the federal level and at the provincial level, but we remain in a good position to be able to pivot and change with those and remain in a strong position into the future. So that's all I have on the report, and happy to answer any questions the board might have.
Thanks, Charles. And maybe I'll just put the motion out, and then we'll have a discussion if anybody has anything. The Board of Health receives the BOH report, the BH01, March 03121, R01, WDGP H, Annual Privacy Program Update 2020 is presented for information. Any questions? June, you're putting it up. Are you putting it up, or you had a question?
I just want to thank Charles for your summary, but I am moving receipt, Mr. Chair.
Thank you. And Christine, or Rodrigo, sorry, Rodrigo is seconder. Any questions? Again, Charles, well done. Thank you for that good report.
Thank you.
All in favor? Approved. Okay, moving forward. Next up is communication update, and
well, thank you very much. I'm gonna speak to this one, but okay, I am wondering if my communications team can turn your cameras on. Annie, Dana, Danny, Maria. I don't know if anybody else is on from the communications. I can see those faces that are on. And welcome. I just want to introduce you to my small but mighty communications department. And this report is looking back specifically at really 2020 and the impact of COVID. And so I actually asked them to do this because it was a tremendous year. Danny, when did you get hired? Was it February or March? So literally like weeks before COVID hit, and he probably
Today is my 1 year anniversary.
Today's your 1 year anniversary. So there you go. So 2 weeks before COVID hit, we have a new employee, and here we are with our media coverage. So just to give you an example of the difference. So we issued 61 media releases in 2020. Normally our previous year was 18, and we thought that was a busy year. 2019, we had 317 articles about us in WDG, and in 2010, we had 2,743 articles in all kinds of different media outlets. Print impressions went from 4 million to 34 million, 2019 versus 2020. And as well as our digital impressions also increased by 13 million, and our Instagram followers, Facebook, Twitter, all had substantial and huge increases. It has been, I've gotten to know this new team very well because Danny's new, Anna's new in the role. I've never known Maria quite so well as we've had this year, all of our chatting, because it has been a huge year for media. And one of the things that I think we would all agree, it's been for the most part, very positive media and very responsive. And I couldn't have done it without this crew and even a lot of helping me to respond to media requests or even requests from the public responding to, access for presentations, for talks, for information. We do have other teams in the health unit that have been supporting. We have a liaison team, but communications really is very front facing, working with our community partners, whether it's our hospitals, our family health teams, our municipalities, to keep on message and ensure we're working collaboratively. So anyways, kudos to this team. And anyways, I just wanted to bring this report forward for your information.
Thank you, Dr. Mercer. Christine.
Okay, I just have a quick question for you, Mr. Chair. Under the website communication, I was just wondering, so I've received a few emails with respect to the dashboard, and then at council I asked you the question, you explained it, and then again today with the weighting. And so I'm just asking, is it possible when we go on the website, you have the public advisory and then it's red, and then you can touch read more. Under the read more, is there something like an update that you can put on there? Like I'm talking very like summarize, an explanation, like short and sweet to explain, because when people are seeing the, green, yellow, and maybe there's one red, it doesn't make sense to them. They don't understand the weighting process. And so I was just wondering, could we put something in there to explain why we are indeed in red?
That's a great question. And this is, we always try to listen to the feedback. I mean, certainly we want to be good communicators. So we need to hear what is happening. And that's why I did start off this meeting today with sort of trying to do an explanation, because I do agree with you. It's people think that each one of our measurements has the same weight, and they don't. And so happy to take that back. And I could see Anna was shaking her head as we were talking to think about how can we clarify what we put up. I know, as you can see, normally in a typical year, to be perfectly frank, our most popular page in the health unit is usually our jobs page, as it is many public sector. And this year you'll see our top 5. Every single one of them is to do with COVID, and and our status of cases in WDG is highly read all across the region. It is a very, very popular website. So if we can make it better, we'll try and make it better.
Okay, thanks for your help, Dr. Mercer.
Mm-hmm.
And just on that point, Dr. Mercer, I think you have been very reactive to a lot of our comments over the period of time. The dashboard has changed over a period of time, and when we've been able to add certain things that people have asked for and that type of thing. I know with the mapping for the individual towns, that was a big thing. That works really well, so that you can see, again, where everybody is in the whole area. So those are all great things, and we've been reactive. So keep up that, and anybody's got any comments, they can let us know. Okay. Thank you. Okay, I have a motion here that the Board of Health receives the BOH report BH01 March 03/21 R02 communication update looking back at 2020 as presented for information. And Christine and Alan, and all in favor? Opposed, of any? Approved. Okay, going forward. Next up, we have committee reports, and we don't have anything from the executive committee or the human resources. And I'm going to turn it over to Chris White to do finance audit. Go ahead, Chris.
Thank you, George. Appreciate it. I've got 4 items to cover off here. The first one is the Mosey & Mosey information session regarding group benefits. At the end of the day, the net is our benefit costs are going up about 25%, but it's not that unusual as we go through these various cycles. And we've got as always with everything financial right now, we've got a COVID unknown. So we may have had less use in the beginning. We expect a bump later on, and just costs are going up based on use and so forth. So the direction at the end of the day to staff, as always, is to do the best that they can going forward to look for some possible savings. It's a very comprehensive report, a lot of numbers in there. It's there for your perusal, and I just wanted to present that. Now, I apologize for this. I can't remember am I doing motions or am I receiving this for information? Sylvia, can you help me here?
I'm sorry, you're asking if you're doing motions?
Am I just receiving this for information or have you got a motion for me?
No, in this case, you were just giving an update on the Mosey and Mosey.
Okay,
You
and
don't
the other
need it.
three?
The other three, you were asking for motions, yes.
Okay, the ones you sent me already or?
Yes.
Okay, perfect, thank you. Just want to make sure I get this right before I start acting like George. Okay.
Right on.
So, Mosey and Mosey, are there any questions from the board on the Mosey and Mosey? All right, the motion is to receive it for information, moved by June, seconded by Guy. Are there any opposed to receiving that motion? That is carried, thank you. The second item is the KPMG audit planning report. This is basically an overview of how they're going to be doing the audit planning for this year. Again, quite a comprehensive report, a lot of detail. It's there for your information and receiving that for information as well. Can I get a mover for that? Moved by June, seconded by George. Any questions from the board? Any opposed to receiving that? That is carried. Thank you. The next is the 2020 fourth quarter financials. So at the end of the day, very confusing year. We ended up with about a $54,000 surplus. And I just want to say that I think if we just step back a little and look at where we actually were at the beginning of this year, before COVID, we had budget issues already based on the fact that we weren't sure what the provincial changes or legislation were going to be with boards of health. That was our initial unknown heading forward. And so staff did their best to craft a budget on some unknowns. So for example, when I get to the reserve report, we in 2019 did some proactive pay downs of some of the building costs and so forth. So at the beginning of the year, we were looking at that. And then we headed into the pandemic and the COVID. And just from, knowing what went on at the county and the GRC and the various boards, it was an absolute unknown moving target. Who knew what things were going to come out? But the Board of Health, unlike some of those other agencies, were absolutely primary care here. It's all hands on deck. We've got a pandemic emergency and the board needed to do everything it could possibly do to deal with the crisis. And they did an amazing job as things moved along. So all of that said, the financial staff dealing with all of these unknowns and cost increases with staff increases and things that weren't being used as much and PPE and a whole complicated mess. At the end of the day, to come in on a budget this large, around $54,000 surplus is quite an achievement. And I just want to make sure that I give all the due kudos to our staff. I know that it's not a done thing. We're not out of COVID yet, and there's still a lot of unknowns, but a job well done, because I know there were times when, frankly, some of us are probably looking into a bit of an abyss because you didn't know. All of that said, all of the services and more were carried on by staff. They did everything they needed to do and more, and still got the budget in line. So I want to thank the folks for that. So if that's all I have to say on that. I have a motion here that the Board of Health makes a that the Board of Health receive the Finance and Audit Committee report BO4 March 0321 R01 2020 fourth quarter financials as presented for information. I think that's sufficient. Can I get a mover for that? Moved by Rodrigo, seconded by Ralph, I believe, unless he's just pointing at me. Are there any questions from the board? Seeing none, are there any opposed to receiving that report? That is carried. Thank you. And finally, we have the reserves and reserve fund status. Again, the information is there for you. And this was also a bit of a victim of changing circumstances. There was a commitment from staff, if you recall, because there were some questions, more general questions on reserves over time, that they were going to provide us with an updated reserve funds policy that is still in the mix. That's just been kind of put on hold as they deal with the immediate situation and deal with the budget. So I just want to give everybody a comfort that will be coming as soon as staff has time to put that together. And so I'm just going to go right to the motion, and then we'll see if there's any questions. I have a motion that the Board of Health receives the Finance and Audit Committee report, BOH November 03 Reserves and Reserve Fund status as of December 31st, 2020, as presented for information. Can I get a mover for that, please? Moved by Christine, seconded by June. I'm dying to call you iPad again. Are there any questions from the board on the reserve funds? Any opposed to the motion? That is carried. Thank you. And once again, just as a final, thank you very much for all the hard work the finance staff doing. I know it's a year that no one's going to forget. That's it, George.
Thanks, Chris. And just on that, I just like to thank as well the province and through the feds and the province to help us with our budget as we went along. As we put extra expenses that we weren't aware of at the beginning of the year, they've been coming through and helping us, making sure that we're whole. And again, thank you to the staff working with the municipalities as well. I think people forget that public health is really mostly funded by municipalities. So these other extra things that they've had to do to make sure that we're looking at the pandemic is over and above. And the province has come through, and that's helped us as well. But at the end of the day, you have to keep all those records, and it's totally amazing what we've gone through. So great job by the crew. Okay, basically our next up is correspondence. We have 2 letters on there. They're similar letters, so similar things. So I'm just going to read the motion, and then we can open it up for any discussion that might want. That the Board of Health receives the above noted correspondence as presented for information. Can I have a mover and a seconder for that? Christine and Rodrigo. And is there anybody want to make any questions or comments on that? I think they're pretty self-explanatory. Anybody opposed to receiving these? Approved. Okay, that's it. And I believe now we're going into closed. So if I have a motion to move into closed, Alan and Rodrigo, all in favor? Anybody opposed? Carried. So thanks everybody, and we're heading off into closed now. And I think we have to go off and go sign in a new signing area.
Correct.
Thanks for the
Yes.
meeting.